Hi everyone, my name is Martijn and welcome to the third episode of the Sunstar Conversations Pro webinar series. Thank you so much for joining us today. For those who are not familiar with this series, we are discussing oral health challenges across different life stages. Until now, we have discussed the pregnancy life stage, talking about pregnancy and periodontal disease, and the childhood life stage, discussing prevention of caries in children. In case you've missed those, go visit our YouTube channel, and while you're there, don't forget to subscribe and hit the notification bell. So back to today's episode, in which we'll be talking about teenagers and one of the most interesting oral care topics for this life stage, oral hygiene and orthodontic treatment. And before we start, just a little housekeeping. If you have any questions, you can ask them in the chat function on YouTube. Go ahead and try it out by letting us know where you're from. Also, it would be great if you could share your biggest professional challenge when it comes to oral hygiene during orthodontic treatment in teenagers. Oh, and by the way, if you're watching from the Eventbrite page instead, click on the Watch on YouTube button. It's on the bottom left corner of the video screen, and that will take you to YouTube. All right, so time to introduce our speakers of today, starting with Kristy Menage Bernie from California, USA. Kristy is a registered dental hygienist, international speaker, educator, and author, and she's director of her own educational bureau. Hi, Kristy. How are you doing?
Good morning for me. Good afternoon for you.
It is. Now, I understood you had to get up at around 5 a.m. in the morning to join us. So I guess the most important question of today is, besides good coffee, what is your secret?
Well, fortunately for me, I get up early and just so happy that Starbucks is now back open at 5 a.m. So we're good to go.
So you got a good coffee. That's good to know.
I did.
At least, your dedication to join us today so early is much appreciated. And I wanted to ask you before we start, what is your special?
Oh, I think we lost you. I think we lost you.
Reconnect. Am I back?
Yes, you're back.
Ah, good. I'm back.
It was my end, and I've shut down every device so that I can solely focus on this connection.
I'm always afraid that this will happen.
Not me.
I'm always afraid this will happen, and now it did. But it's good that I'm back so quickly. No, I was asking you, your dedication to join us today was much appreciated, and I wanted to know what your special connection with the topic of today is.
Oh gosh, for years I focused in the orthodontic sector through Damon, and boy, did I learn a lot. And I really walked out of that segment in my career with a huge, much larger appreciation for, number one, the specialty of orthodontics, and number two, the unique challenges we face with those patients. So it's one of my favorite areas of dentistry.
All right, sounds good. I think we have a lot to talk about today. Perfect. Okay, well, let's move on to the second speaker of today. It's Mário from Portugal. Besides being a licensed dental hygienist, Mário also has a master's degree in health psychology and a PhD in psychology. And he's also adjunctive professor and director of the dental hygiene program at Porto Alegre Health School. Welcome, Mário. How are you?
Hi, you said Porto Alegre very well. I'm okay. Thank you for the invitation. It's really a pleasure to be here with all of you. Thank you.
Good. So I assume you're doing good. Now, you have a background in psychology, which I think is a very interesting addition to your skill set as a dental hygienist. Is that maybe also why you are attracted to the topic of today?
Yes, I think, well, psychology, there was a time when I was lost between dental hygiene and dental school. And more and more I was discovering that patients and the way they interact with us is something that it's a topic that I really love. So I decided to travel to this land of psychology. And the funny thing in oral health is about all the chronic problems and the long-term treatments. And orthodontic is a challenge for us as health professionals. And it's all about connection, cooperation, and all those kind of things. So it's, for me as a health psychologist, also and besides the dental hygiene, it's a perfect mix. It's really a wonderful topic. So
Yeah,
I'm very excited.
All right, good to hear. Well, okay, since we're all excited, let's get started. And I wanted to start with setting the stage. And I would like to discuss some fundamentals of successful orthodontic treatment. And I wanted to start with you, Kristy. You have quite some experience as a speaker, as you mentioned, on this topic. What would you usually say during one of your lectures to be the most important determinant or most important determinants of a successful but also an unsuccessful orthodontic treatment?
Well, I think the focus initially was certainly hard tissue health, because there's nothing more devastating than having orthodontic appliances on and then biofilm accumulating around the brackets, causing white spot lesions, demineralization. But what I learned very quickly when I got into the ortho community, periodontal health is almost as critical, if not more, because we know that teeth move quicker when soft tissue has health and resilience. So it's a combination. Hard tissue and soft tissue health are a must.
Mm-hmm. Yeah. So in that sense, unhealthy tissue probably prevents moving of teeth. And what would you then define as an unhealthy oral environment?
Well, any kind of gingivitis, any kind of inflammation, and of course, the obvious being biofilm accumulation around those appliances.
Mm-hmm.
A lot of times we have to back off our orthodontic appliance treatment in order to resolve these issues. So that holds it up as well.
Mm-hmm.
Mario, what's your experience been?
No, Kristy, I'm so happy that you move on that way, because I completely agree with you. I think the focus is the healthy tissue. That's the main point, of course. And for us, that we are related with prevention and with control, that's our main role, to keep all the tissue around the forces and the appliance and all the different appliances we have. It's become it health. That's our main point, because then all the plan, all the engineering that is behind orthodontics, it will move forward in the right direction. So completely agree with you. And I think I that's one of the things. I'm here in my dental clinic at school, and we have some students here. They will not show up because they are very shy. But one of the things we are always saying to them is, don't think about cleaning, think about health. Think about how to maintain the tissue health. That's the main point.
So yeah, I mean, totally agree. And when you think about these determinants, Mario, and perhaps this is obvious for an oral care professional, but what are the fundamentals for achieving healthy tissue and a healthy oral environment?
No, I think, well, I think Kristy probably will go a little bit deeper on or she can give us her opinion about the techniques. I would like to address one thing that I think it's fundamental. I think 80% probably of the success of the orthodontic treatment is the cooperation, is the teamwork between what we call this, I wrote it here because I like this word in English, a threefold relationship, each between parents, professionals, and the patient. And that collaboration, that threefold relationship, is the basic for the success the success of the treatment, which we cannot. And that's also something that it's very interesting to understand and to look. And I think sometimes we think about the orthodontic treatment and we think about the dental hygiene and maintenance. And I truly believe that there is only one treatment and everything is part of the treatment. You cannot think about orthodontic treatments if you don't think about the maintenance, the control of the infection, the compliance with the patients, the understanding of the patient. So everything is a treatment. What do you think, Kristy?
Oh, the C word, you said it.
Yes.
We've been waiting, right? The dreaded dun, 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 compliance, right? I mean, anytime that word comes up, I see the fear, my own fear ramps up, that term, compliance. And again, I think when I graduated way back in the 80s, our focus with this population really was plaque control, more for hard tissue, but it's the combination, because we set a whole cavalcade of issues So compliance becomes sadly a little bit more complex. But Mario, I know we have some great ideas and solutions so that compliance isn't quite as scary.
No, it isn't. It isn't. And I know your English is much better than mine, but I would say that even instead of compliance, I think collaboration.
Love it.
Even,
Thank you.
yeah, because that makes everybody on track,
And it's less overwhelming.
Yes.
Collaborative sounds like a mutual kind process. Compliance is, I need to force you to comply. I need to force you to do this or you're not going to be well. And anytime a human hears that, excuse me, regardless of age, that's going to set up some challenges out the gate.
Yep.
I love it. I love it.
And talking about compliance or collaboration, as you put it beautifully, that of course not only relates to plaque control, but as you mentioned, it goes beyond the technical cleaning. What other factors are there that sort of determines orthodontic success behind the plaque control? Is there maybe a factor for lifestyle, for example?
I'm not sure what the question was there, but
going beyond the plaque control, is there also a role for other environmental factors that determine the success of an orthodontic treatment, for example, diet or lifestyle? And
absolutely. Diet is critical. Lifestyle is critical. And I always like to think about what motivates us, regardless of whether you're in orthodontics or not. And I call it smell good, look good. And if I added a third, feel good. And when we consider all of those factors, we create motivators and lifestyle habits. Nobody wants to be told they have bad breath. So if we create optimal oral hygiene habits that can prevent that condition, there's an example. Mario, what do you think?
No, I agree, of course. And one of the interesting things in orthodontics and all, if we think about all the things you say about health habits, nutrition, oral hygiene, sports, that's part of our healthy life in general, right? And that's a struggle for us that are related with prevention, that are related with the health issues. That's what we want to achieve to our patients. And they are sometimes so tired of listening to all these things because they say, yeah, we know, yeah. So I remember on the other day, we were talking about how amazing it is that orthodontics can be an opportunity for general health, because that's the time that you are, sometimes if you are not on the mood to listen to us, we talk to you and you don't listen. Orthodontic opens a door. So most of the patients, not all, they want the treatment. So they want everything goes well because it's related with appearance, something that it's part of the growing up process. It's cool nowadays, not when I was young. I remember that my cousin, she had a really, really bad crowded situation in the mouth, and she had this treatment, orthodontic treatment, on the 70s. Nobody used it, orthodontic appliance on the 70s, at least in Portugal, just a small amount of people. And we always think about James Bond. I don't know if you like James Bond. There was this old villain with the iron teeth, you remember?
Yes.
We call her that. So we were so mean. But that wasn't the oldies. Nowadays, people like it. Kids like it. They cry if we say, you don't need orthodontics. I have patients who cry. My wife is an orthodontics, and we work together. And sometimes when we say, no, you don't need orthodontics, you have tears. Like, I want the brackets. So we have this open door to show them the importance of eating well, making exercise, control the gingivitis. You are working. It's such a hard work. You have to pay the money. So it creates it creates a huge group of arguments that we can use to help general health. So it's amazing. It's really very interesting to see the opportunities that orthodontics can open to patients.
I remember this. I underwent orthodontic treatment myself, and I remember I think I was 12 or 13, and the day I heard, yes, I think we should start orthodontic treatment. At that time, it was probably the worst day of my life so far.
Yes.
And that was, I mean, it's not so long ago. I mean, it's in the near past. And I'm really happy to hear that this sort of paradigm has also shifted. And I think it is a big facilitator for teenagers nowadays, that it's not so much of a of a, how to call it, a taboo almost to undergo orthodontic treatment.
Oh, and in fact, in parts of the world, in hair salons, they will apply fake appliances to teeth, which cause all types of problems. Like, we don't have time to go into it. So you're right. The stigma associated with metal mouth, brace face, that doesn't exist today
anymore. No.
That's really that's a big improvement. Absolutely.
Yeah, I remember the story. That was this girl. She was supposed to finish the treatment, and she asked to stay for more 15 days because it was the prom, the final prom when you finish high school, and she wants pictures with the brackets on the graduation day. So can you see the connection that this kind of treatment is creating nowadays? It's amazing.
Absolutely.
Yeah. As I like to say, shift happens. That's my yoga teacher. And in ortho, we want shift to happen, right?
Yes, also.
It's a huge paradigm shift, and one that we can take advantage of.
Yeah. Cool. Now, with that in the back of our mind, seeing the opportunities, going back to the patient group of today, teenagers, what makes them so unique? Are there also specific challenges that we have to take into account?
Mario, you take this one. I love how you look at this.
I think if we look to child are childs. They have different personalities. The child are child. Elderly people is elderly people. Adults, and teens are teens and other children and an adult in the body. It's a mix between, So that's what makes them so special. And it's such an age of change. It's such an age of growing up. I remember that probably some years ago, being a teen, it's completely different. We are talking about shifts. Yeah. What being a teen today, it's completely different of being a teen some years ago. Now I think it's more difficult. There are no rites of passage. People don't know when they should, the rites are much more scrambled. So it's kind of complicated. But I always think that teens are like a piece of clay that we can mold, and they want to mold themselves. But we have this part, we help them to grow up, to have a form. We can be part of that process. So in one way, I think teams are an amazing challenge for us as health professionals. And if you are looking about behaviors, that's really a great challenge. And we have, because teams are very based on roles, they are looking for different roles. Sometimes it's very difficult for the parents because it's supposed to have some fight and some distance, and there are a special environmental around the family. But they like other roles. And if you know the right rules, if you know I was reading, I wrote something here because I don't want to forget to say, there was this Michael Feis, this author, he said there are 7 important needs for the teenagers. Which is the need of trust, the need for dialogue, the need for security, the need for autonomy, responsibility, affection, and hope. And the funny thing is that we have all those tools. We have all these tools in our office. We can work with all these tools. So it's a challenge because we need to know that. That's why we were discussing with Kristy this idea of compliance, of me, I know the rules for you. No, it doesn't work. You have to be a bi-directional, 3, whatever, 4. There are so many things we can do in the way we build the treatment plan, the relation, that we can be a very important tool for help the what we call the assertiveness of teenagers, which sometimes is very complicated for them, but it's part of the process. So I think it's a challenge. It's a man and a child mixed between. It's a beautiful time. I would love to go back to those moments. It's such a huge amount of discoveries. You know, I don't like the pinballs. Is that the right word, Kristy? Pinballs?
That is the right word. Yes, yes.
But they are so good things for them, and I'm truly honored to have this opportunity to work with these young people, and I think it's amazing. It's an amazing time.
I think you should build a seminar around those
too poetic, Kristy, or it's
no. Build a seminar around those 7 factors, and then bring in the dental component. I'll sign up right now. That bingo, and that's a nice roadmap. If we're hitting all 7 of those, guess what? You're going to be really successful.
Yeah, I think so. And we can work on those areas, right? Completely. Trust, dialogue, security. That's part of the relation with the patient, and if it works so well with this kind of area.
Yeah,
right.
Absolutely. I think this brings us to more the psychology of the orthodontic treatment, you know, and that's of course very interesting with your background, Mario, and you as well, Kristy. You probably also have quite a lot of experience with this. Maybe it's a good idea to go by these 7 factors as you mentioned, Kristy, and just to see one by one how they apply to orthodontic treatment in teenagers. I think that nicely fits the scope of today.
Yeah. So if we think about, for example, the trust, if you think about mouth and about what the orthodontic appliance imply to you as a teenager, you know, so because you are growing up, there are so many things around the mouth that's important for you in this age: sexuality, affection, communication, you know, everything is there. So mouth is really, really important. And the dream of making you, on the other day, I was reading an article about this lack of rights of growing up, and they were saying maybe orthodontics could be a ritual of growing up, because you have to wait, you have to be responsible. Even us, we can do that. We can say
you have to be patient.
You have to be patient.
Ooh, yeah.
So imagine we can help them to grow up with this ritual of responsibility. We trust each other. They trust on us to make them different. I don't know if more beautiful or whatever. It doesn't, I don't know the right word, but at least different. Something they hope, they want. And that is about dialogue. Listen, what the patient wants. How can I help you, right? This idea of creating the process with the patient, it's so important because, of course, I'm not a dentist. I don't know anything about planning orthodontic treatment, but I know how to help the treatment goes on the right direction.
Yes.
And this idea of dialogue, of saying, okay, what do we want, of growing up and making this voyage together with them, it really helps the process. It really helps this collaboration process. And if we talk about security and the autonomy, and because it's a lot of autonomy here, right? And we were talking about it's more than, say, brush or floss or use the interdental brushes or power brushes or soft picks or whatever. It's like, okay, what is good for you? Where do you feel better to control this problem? And then even this autonomy, it's something that is a self-awareness of the patient, and we know that is very important for them.
Well, the other thing that you've said in the past that I just really believe in, instead of the term challenges, let's look for opportunities and use that type of dialogue consistently, meaning positives versus if you don't do this, this negative will happen, and change it. If you do this positive will happen. And then that positive reinforcement when a patient or a client, depending on where we are in the world, is doing things right. Maybe they're not 100%, but that positive feedback starts to build on behaviors. So I'm a huge fan of saying, oh man, instead of this is a huge problem, I say, okay, wait a minute. What's the opportunity here? There's really an opportunity.
Yeah, you have this idea of if you don't focus on the problems, but if you focus on the solution. There is this amazing, beautiful movie called Patch Adams with Robin Williams.
Yes.
Yeah, you see, and he's
Oh,
always
I love it.
he says that if you focus on the solution, you can see a different world. If you focus on the problem, you are stuck on the problem. There is one beautiful scene in the mental hospital. It's a beautiful scene. You can see it on YouTube. And so, and yes, I completely agree with you. It's the idea of responsibility, and because they are not a child anymore, this is a good time to say, okay, it's your responsibility. Let's do this together. And so it's in your hands to make this process well. And this is good for them. This is when you have this, when you are able to make these bridges, I think it works pretty well.
Well,
it's not easy,
what we're
but
experiencing in the world right now, focusing on the solution.
Yeah.
I mean, what optimism and hope for the future. And the World Health Organization has an exercise where you draw 2 circles, and in the center circle, you think or write down the things you can control. And on the outer circle, all the things you can't, right? And we look at the bullseye, we look at the center, and keep focused on things we can control and the positive outcomes. And it pun intended, it makes a world of difference. Thank you, World Health Organization. And it's a variation on the theme, but it applies almost in every scenario we can think about.
Yep.
Yeah.
Right?
I love it.
Can the patient control plaque control? Sure they can.
Yeah.
You know, give them the tools, the education.
Give them the tools, yeah.
Yes.
You know, don't worry so much about, white spots or puffy gums or what. No. Yes. Let's think about the things we can control right now.
I love your analogy, Mario, also of a teenager being an adult trapped in a child body.
Yes.
And this confliction is also sort of reflected into the balance between looking for autonomy, but also looking for security at the same time. You know, these are 2 completely conflicting concepts who are probably in balance with each other, and especially in the teenage stage, I guess this is more prominent than ever. And as an oral care professional, if you can sort of grab it as an opportunity to use it into your advantage, but more importantly to the advantage of the patient, I think then you probably have the winning formula.
Yep. Yeah, I really like this idea of opportunity. We have such a chance when we have these teenagers that, and if you think about the relationship, because the treatments are long, you know, with the dentist, with the oral health therapist, or the dental hygienist, or whatever, you know, it's such a group of people that he learns to know. And if you are able to do the journey, a pleasant journey, some of these patients or these kids or these persons, these young adults or adults to be, whatever, they're like sponges. They absorb a lot of things. They see role models, what they like, and of course what they don't like. So it's a great laboratory, and I think orthodontics, the dental team, has a great role for some of those patients, not only to oral health, but health in general, and even health in general, because then we put everything, oral, mental, everything.
Yeah. I think you hit it on the nail there. And when you think of the orthodontic treatment in teenagers is something that they really want, as you mentioned, you know, this is something that is like almost a personal objective to them, rather than something that is being forced onto them by someone. So I assume that makes the oral care professional, the dentist or the oral hygienist, more of someone like a coach or someone who supports them, rather than someone who tries to force them on something. What do you think?
Oh, absolutely. It's some of the most successful ortho practices I've been able to visit. There's one in particular I'm thinking of. They created what they call the hygiene wheel, and they had a red rope like you're going to a movie premiere, and you worked your way around the operatory chairs for different preventive strategies. So let's say the first stop was biofilm control. The second stop was application of chlorhexidine gluconate varnish. I'm a big fan of anything we can do for the patient while they're there. That's going to have an impact when they leave. We should be doing it. The next might be fluoride varnish. There could be an air polishing station. So those types of practices that made it exciting and said, we know you are excited to have this going on for you right now, and you've made an investment. Well, we're going to make an investment back, and this is how we're going to do it. And they make it exciting and fun. So to me, do what you can for the patient when they're there, build that relationship, show that we're invested, and get creative.
Yeah, Kristy, I really love those ideas. You just hit the right point. You know, we know that curiosity creates involvement, you know, and if you think that sometimes we go to the dentist or to the dental hygienist and we already know what's going to happen. It's the same over and over. So if you change the game, if you create some curiosity, they will say, wow, that's completely different, right? So this involvement created by curiosity, and we, you know, nowadays it's more easy. It's not so easy because you really need techniques to do that. You need to know a little bit, but it's amazing. For example, we use intraoral cameras, and intraoral cameras, it's like National Geographic private, you know, like you go over the mouse and you see, and you don't criticize, you just show the details, and for the teenager, that's amazing. That's,
Huge.
you know,
Huge.
and there are so many good examples. Sorry, Martin?
I said it's an eye-opener, probably, for them.
Yeah, it's an eye-opener, and it changed the game. And this idea of changing the game, of making something different, and we have apps, and we have computers, and we have. I love the idea of making like a scenario, and you know, like you said, the movie, and there are so many things we can do.
This is what I would love to discuss next. Is what would be sort of practical tips that people who are watching today can directly apply into their daily practice, not only from purely the hygiene perspective, but also from how to leverage technology, trends. Can you maybe share something about that?
Okay. And again, I try to divide it hard tissue, soft tissue, even though they're connected. I can't say enough about doing what we can do while they're there in the chair. So air polishing, use of chlorhexidine varnish, use of fluoride varnish, any kind of education, of course, focus on soft tissue health. But beyond that, once they leave, what are we going to do? And here's another get ready shift happens. Can we just toss the floss for this population? It's already complicated enough. And it's been 2 or 3 years now. The American Dental Association, on their beautiful consumer education website, they've changed it. Instead of brush twice a day and floss daily, it now says brush twice a day and clean between. So I don't care what it is that you're cleaning between. I mean, and then add it to technology, app connected toothbrushes. We know power brushes are safe for interdental care. The winners in research, water irrigation, so water floss, or even more interesting and an innovation, tooth shower that has this device that does 8 splashes all at the same time, irrigation streams. To bigger winner is the obvious, and that's interdental brushes. And I just can't say enough about moving away from, are you flossing? Change the dialogue. How do you clean between? And watch the shock and awe. The patient's going to say, what? No F word? No floss? No.
I think this is shown in the research over and over again over the past decade.
Absolutely.
Yeah, I completely agree. That's the trend. You know, the trend is interdental areas. Keep it free of biofilm, keep it free of infection, and then in the technical way, we can say that you have to create an alliance between you and your patient. You know, it's something that it's a therapeutic complicity between both of you, and then you have all the tools, amazing tools, and of course. We were invited by Sunstar, and thank you so much again for this. But I have to say that soft pick is such a great invention. You know, it's make it easy. And come on, people, it's not about cleaning between the teeth. It's not about the importance of cleaning between the teeth. It's not that the main point. The point is how to do it. Do it. It's to do it. We know it's important. Come on, since
bingo.
1940. Since 1940, we know it's important. So let's make tools that have people to do it, right? So that's why probably power brushes are fantastic. That's why the new, different kind of interdental brushes are the way. That technology can help to create all this social support, because it's when you are. It's funny because when you go to the dental office and you have just a gingivitis or a gum problem or a teeth problem, you talk with us and then you move away and you don't remember because the pain go away or you don't feel the gingivitis. In orthodontic, we have a good tool because you never forget that you have an appliance in your mouth, so you remember us, right? So you have this connection with the professional because, oh my God, it's hurting me. It's something stuck. So it's always like a buzz, bang, bang. It's if you create a good alliance, a good relationship, a good strategy, and it's like a game. It's chess. You have so many strategies. So even that is also a good help for us. So you have the tools, then you have to create a good plan. And if you think about behavioral interventions, about changing behavior, if we talk about all the new models, COM-B or the GPS that is, goal setting, planning, and self-awareness. If we think about these three things, then it's up to us to create a goal, what we want for them, how we build the goal, because that is important for every patient. And orthodontics is also, of course, super important. And for the teenagers to have a goal, to have this responsibility and autonomy, as we talked before, and then you have like this planning, for how long I'm going to do, what is they expect I have to, what should be the results I have to expect. It's not only, as Christian said, it's not only give an order to them, it's make a plan, where I want to go, what I should achieve, and let's feedback on the next appointment, and then all the things will have the chance to work. In this relation, in this therapeutic alliance, there are no magic ones. There is no Harry Potter. But even in Hogwarts, you have to work for yourself. You have to eat well in Hogwarts. It's no magic if you don't eat well, So magic is not for everything. So it's a strategy. It's not easy, but it's so much fun to think about an orthodontic treatment with this special kind of patients, and to think in the broad sense of how we put behavior, how we put the technology, how we put the biofilm control, how we put the technology of moving the teeth from one side to another, everything in a big umbrella, and help them to achieve the result. It's such a...
And I love that. GPS. Now, what was the S?
Self-awareness or self-monitoring.
GPS. And people can relate to that. Who's not using their GPS?
Exactly.
Yeah.
Mario, I can't wait to meet you in person.
No, but there is a nice systematic review made by Tim Newton, and and the other author has a Greek name which I always forgot, and they are talking about this behavior intervention, and I can send you the article. It's very people should read it. It's very interesting, and these three things: goal setting, planning, and self-awareness or self-monitoring, are probably the three important techniques to be able to change behavior.
We'll put the paper in the description in this YouTube video.
Mhm.
And what I think is, talking again about opportunities, what I think makes the orthodontic treatment so special in this GPS is that the goal setting, usually there's, I think, a discrepancy between what the oral care professional thinks is important and what the patient thinks is important. You know, we always think health is important, everybody knows, but maybe this is not the case for the patient. I think in the case of orthodontic treatment, you both have the same goal. So you both know where you're going. So in that sense, the GPS is, you know, entered in the same way. And I think that's probably the big opportunity that we have in orthodontic treatment in teenagers.
Yeah.
Yeah.
And you know, one thing, talking about this idea of responsibility, and one of the good things, and sometimes it's missed a little bit, and but this is a great opportunity in orthodontics. It's you have a time before the treatment. So when you prepare the patient for the treatment, when you say, "Hey, those are the rules. Are you with me? Let's do this together." So we have time, because it's something that we plan. There is a plan, there is a study, there is X-rays, all those things. So you have time to plan with them. So it's no surprises. We say, okay, of course, there is adaptation, there is negotiation. It must have, that must exist, of course. But we have time. So that's what makes this thing so amazing. The orthodontic implants, but looking to orthodontic, we have this opportunity to plan.
Yeah. Okay. I see. I mean, we could probably talk about this for another hour, but I see we only have 5 minutes left on the time.
We are
Yes,
talking
yes,
for
we
another
do.
hour.
So maybe we can reconnect backstage afterwards and just continue the discussion. In any case, I think it would be nice to answer some questions from the audience. Let's see if there's something there. They're saying, great topic. Can you comment regarding compliance in light of COVID-19 and this age group with cleanings and orthodontia? Who wants to go first?
Well, I'll take a stab at this, but I want full disclosure. I'm not in clinical practice, but everything I'm reading and the ADA's and their Health Policy Institute have done a good deal of surveying. And I know that we're back, meaning we are being seen. I have to imagine, and Mario, I'd love to hear your thoughts, that this has had an impact and not in a positive way.
Well, it's so strange. I don't know. Maybe this is geographic or cultural. I can say the experience we have here. For example, here in Portugal, we had to close in the first time in 2020 on between March and July. We closed. Everything was closed, and patients were panic because I think that's the good thing of oral health professionals. When your clinic is not one thing that you create last month. It's something I work in the clinic, for example, for almost 30 years. And people trust you. And when people trust you, they know that before COVID, we had hepatitis, HIV, so many viruses, so many things, tuberculosis. And we always were worried with that. We had all the measures. Of course, COVID was a planetary thing. It was on the news, was crazy. But the funny, and this is my sharing. This is my experience sharing with you. Maybe it's not scientific, but what we notice is that people, they really trust us. They said, okay, I want to control because I know it's important. You already told me. And please help me. And at the same time, people were saying, if you don't have infection in your mouth, you are secure. The level of virus, the virus load is lower. So people want to come. At the beginning was difficult because here we didn't have masks or protective gear. It was everything sold out. So it was really impossible to open. But when we opened with all the full security, our patients were there for us, and they were really, really important. And the funny thing is, they were at home, so they had time. They started using the Interdental brush more time. Because they were at home, they were close at home. So that was interesting to see. That was interesting to see how these things can turn into good things.
Well, and I have to wonder if that's the first population that was comfortable going back. And maybe some of the biggest things that we had to take away, at least for now, were things like air polishing, because the CDC is speaking out against any kind of aerosol producing procedures.
Yeah.
But there are ways around that too. So I'm glad that question came up. I'd like to see more research on how the orthodontic community in particular has been impacted by COVID, but more importantly, their patients. And Mario, if you're right, maybe it created an opportunity for that population to become more involved in their own self-care.
Yeah.
Kristy, completely agree with you. I think we had this set of arguments. There were so many arguments that we were talking before that suddenly people become aware with all this crisis. And life is about opportunities, right? Use the opportunities in the right time. And there are moments that are more important than others. So health was an issue, was the main issue for the planet. So I hope it continues, and I hope it comes, because we don't know really the research about the air polishing. There are already some studies coming on saying that it's okay if you have a good control of the air section and all those things. So there are so many things going on. So we need to be calm, trust on science. Trust on science. I think that is important. And if you are professionals, that should be the way. And let's move forward to a better world.
Absolutely.
We're going to cheat a bit here, but I would like to see a few more questions. So let's stretch for a bit. Let's see if there are more questions. Dr. Mario, you say focus on the solution. How can we make our patients to focus on the solution? How do we get that link and the technique for archiving that link?
I think focus on the solution. Again, we never have a magic question for everything. But focus on the solution is, what is a problem for the patient? What is the problem of the patient? Look to the patient. See, like Christian said, what are the things you can solve together? If you can solve together, go on that direction. Because sometimes we are stuck. Oh, for example, I love the example Christian said. If I think floss is the solution, but if I think floss was the solution as a professional, but if my patient is not compliant at all, is not doing on that direction, if I just focus on that problem, and I want, and it's not working, and I don't do the feedback myself, I'm not focused on the solution. I'm focused on the problem all the time. So the idea is, okay, we know that that patient has a problem in interdental in areas that cannot control the infection. What is possible for them? And he said, well, I don't like this, but I'm able to do this once a day, or I don't like interdental brushes, but I can do soft pick, or I don't like soft picks. Or even try to understand when is the right time to propose the solution for the patient, because the psychological reactance, if we push sometimes too much, patients move away. So this idea of alliance is it's an important idea. Alliance means it's like almost like cultural humility. I have to understand you, right? I have to understand you. It's not about me as a professional. It's about the patient. So that's the solution. The solution is understand the patient and help them in the best way that fits on that solution, in that patient, right? What do you think, Kristy?
Absolutely. Couldn't have said it better. Yes.
And it's not easy. Come on, people. We are not saying it's easy, but make the exercise of listen, see where they want to go, propose, see the reaction. It's like a game. When you like somebody and you want he or she to go out, if you are George Clooney, you say, come with me, and everybody will come, right? But if you are not good looking, you have to seduct, you have to listen, you have to see what the other person like, you have to make a mood, you have to create a process. And sometimes you get the woman of your life or the man of your life, depending your taste, But it's a process. But you need to listen. If it is just you, I think it's more difficult.
Yep.
I would love to talk more and to answer more questions and to continue for a while, but I'm really afraid that we've run out of time for today. Of course, we will do our best to answer the questions afterwards if we have not able to do so yet. So we will come back to you afterwards. In any case, I want to thank our speakers of today. Start with you, Kristy. It was really a pleasure talking to you. And again,
So fun.
Thanks for connecting so early. You saw sunrise, so that says a lot. Thanks a lot, and for you as well, Mario. Thanks so much for sharing your insights today.
For me, it was a pleasure. Thank you, Kristy. It's always a pleasure to listen your passionate way of talking about things. And Martin and all people from Sunstar, thank you so much for the invitation, Marisa. And it was a pleasure.
Yes, thank you again. Anytime.
Completely our pleasure to have you on the show. And with that, of course, last but not least, also a big thank you to everyone who has joined us today from the audience. Don't forget to like the video, hit the subscribe button on our channel, and also make sure to click the notification bell so you receive a notification whenever we publish something new. You can also find us on Twitter, Facebook, and Instagram at Sunstar Global, or visit our websites, sunstar.com or sunstargum.com, for more interesting educational content. We will be back next month on the 3rd of June, and we will discuss a very nasty condition, dentin hypersensitivity. Why is it affecting more and more young adults, our next life stage, and what can we do about it? Keep an eye out on this channel and join us to get to the root of the problem. Pun intended, of course. Thank you again, and catch you all next time. Goodbye.
Thank you, Sunstar.
Thank you so much. Thank you.